champions to all of us, and we appreciate you very much. Thank you.
Thank you very much. Senator Jackson.
You know, I think I want to thank the chair for bringing this to our attention yet again. I mean, this is just kind of reminders. I don't think anything other than the $2 an hour for me was shocking, but that was shocking. But that being said, we know this is a problem. We know some of the ways to get to solutions. It seems, as was said earlier, that this is a question of political will more than anything. So let's get to that right now. How would you suggest, we're kind of on the inside and sometimes you don't see the forest for the trees when you're so close to a problem. How would you suggest we develop expectations and performance measures, if you will, to address all these problems? Because I know the governor is very, very tight with the public dollar, and it's hard to fault him about that. And you know, as the economy has improved for many, it's not improving for others. And those others tend to be people who do not speak up. And so it's part of our job to speak for them. And while we're here today doing that, we've been here before. I remember Holly when she was just a very young woman as compared to just the young woman she is today. Fighting hard, working for, you know, as a staffer here. And I was here 15 years ago, and this conversation, it's the same conversation. And so we have to move that conversation now to action. And while we're dealing with, you know, we all just came out of appropriations. And it's very clear the Department of Finance is holding on to those nickels and dimes as tightly as they ever have. It's also clear that this year we've got a surplus, but there's some question as to what's available and not available, and then we know that California is cyclical. You know, it's going to go down again. So how do we develop common sense programs that are going to address this critical problem that is almost endemic in our system, and the cycle of violence that we keep seeing over and over again for people who, you know, have worked and have had to deal with just the vagaries of life and health issues that nobody plans for, or problems associated with relationships that go afoul, or loss of job, or lack of childcare. I mean, it goes on, the list goes on and on. So it would really be helpful to me, and probably to all of us sitting here today, to get some ideas from you, setting some performance standards, as we were talking earlier with our departments of social services, how the people there and the front lines can be invested in the success of these programs, how we can get our families out. We know that early childhood education is a critical component, but if you don't have any place to sleep at night, or if you don't have any food in your belly, I mean, it's hard to overcome those obstacles. So it would really be wonderful. We've got, as we mentioned, you know, a stronger California. The Women's Caucus has come together, coalesced around this, and I'm really excited about it. But we also have those traditional barriers about money, and reducing the maximum daily grant, which is absolutely an appalling number, especially in a state like this where housing alone is a challenge, and then child care expenses and the cost of food and the cost of you know, everything that just breathing is such a challenge. What can you help us do to overcome these inherent obstacles? That would be my question.
Before you attempt to answer that gargantuan question, I just want to make sure that committee members know about the issue briefs that are in your binder, because as you said, how do we quantify it? The Economic Policy Institute report, the report by UCLA Labor Center and the UCLA Institute for Research on Labor and Employment. These are some amazing white papers that are in your binders that begin to do some of what you're asking for, Senator Jackson. Who wants to tackle that question?
I'll give it
Okay, all right, Ms. Senderling, and then Ms. Neeringer.
Kathy Senderling, CWDA. It is a gargantuan question, obviously, and we're not going to be able to put together the one silver bullet answer, I think, here. But as I thought about what you were asking, Senator Jackson, I thought a couple of things. One is that it is really hard to task just one agency or one program with that answer for those outcomes, because as I think about the conversations that have happened on the first panel and here about CalWORKs, for example, you asked a really good question of the first panelists. How do we get the employment specialists who work with our CalWORKs families to think differently about how we help them? And I think part of that is on the way, in the sense that we are working toward this more broad-based assessment tool, that we're really hopeful that the families that we're seeing still in our system who've not been able to achieve economic security with this fledgling recovery that we're still in, that we'll be able to better assess their needs. And as we are starting to pilot that, we're finding out that the needs are very robust. And how we serve those needs doesn't just come from the CalWORKs program or from the social services system. We depend on the mental health system, the behavioral health system for substance use disorder issues. We depend on the training and employment system that we don't 100% run. Ms. Bartholomew mentioned subsidized employment, and that's something that we had great success with during the early years of the recession when the federal government made funding available. We've made some changes here in our CalWORKs program, but now that the economy has picked up, we're finding that it's harder to get the folks who are left on CalWORKs placed in those. So I think one thing that is, I don't want to just throw up my hands and say, though, but we can't be responsible for outcomes. To me, then, I think it's a couple of things. It's about having a set of outcomes and goals that perhaps we're all working toward together, and we think about assessing changes to programs or the programs themselves across a variety of our departments and agencies in that view. Maybe similar to what Great Britain did. If they had a sort of, in that case, nationwide goal, maybe here there are some statewide goals, that would help us all kind of have that eye on the prize. And one thing that I wanted to say definitely would recommend be part of that is that question of deep poverty. How do you think about reducing the levels of deep poverty for the children and families and seniors who are in that very deepest level of poverty, because that is such a dark place and so tremendously difficult, as everyone here has spoken to. I think you could get wrapped up in looking at the overall poverty level, and you maybe forget about those folks in that deep poverty level. And so I would encourage that be part of the conversation. I hope those are some helpful thoughts.
And I'll go very briefly and say I agree with Ms. Senderling's comments about needing a comprehensive view, and I think that's the beauty of the Women's Caucus proposal, is it doesn't look at just one sector. It's a broader cross. The other thing I would add is, at least, well, in cash aid assistance and also in child care, the dollars that the state invests are not dollar for dollar out the door. What we know is for every child care dollar we pay for, the parent earns $2.50, $2.75, depending on there's an economic turnaround that happens. We used to see a bigger turnaround because we used to serve families that reached a higher income level, and when we cut the top level of families off, we saw some of that diminish. But I think this is really an investment in our state's economy, and however we can look at framing these investments that way, I think is powerful.
Thank you very much. I would just say my final thought to Ms. Bartholomew, and I only differ with one statement you made in your testimony, and it was with regard to maximum family grant, and you said, that people, we call into question how they were conceived. And I think all babies are conceived the same way, Ms. Bartholomew.
Oh.
Last time I checked, but it could be something new. And so maximum family grant doesn't call into question how they were conceived. It calls into question what form of birth control was used.
Yes.
And that makes the policy all the more offensive. It calls into question because the law lists, colleagues, what form of birth control one could use, and if only those forms fail, then you would not be capped. So it doesn't call into question how a baby's conceived. It's what you did to prevent it, and if it's on the acceptable list. that's what makes that policy even more offensive.
And there are only 2 viable birth controls allowed. There's sterilization and intrauterine device. And so if you are to receive aid for your newly born child to help diaper them, you need to disclose that the child, or that you had something in your uterus when you conceived the child, however that was, and that you have to have proof that the baby was conceived as a result of the failure of that contraception, unless it was also otherwise conceived as a result of rape, but only if you disclose the rape within 12 months of the rape occurring and you're willing to bring forward your private information about the rape and put on file that the child was conceived as a result of rape for the entirety of that child's life in their case file.
Who made these rules? Seriously.
Your state legislature.
But you know who can remove them? Your state legislature.
Thank you very much.
Thank you very much to the panel. We appreciate your expertise. And again, the focus of today, the first panel was on strategies to impact poverty and deep poverty. The second panel was targeted investments to reduce poverty. The third panel is fair wages and working conditions. And one consistent message we've gotten from the first 2 panels is this effort requires a sustained effort, and we must boost wages and income. That leads to our third panelist, Ms. LaFonza Butler, President of SEIU United Long-Term Care Workers. Please come forward. Ms. Butler, welcome.
Senator Mitchell, thank you for the invitation. Senator Jackson, of course. I only get to talk to Senator Mitchell and Senator Jackson, but they'll pass all the notes.
That's right, and we're being televised.
Of course.
Ms. Butler, thank you very much for participating in today's select committee and bringing, I think, the third and final kind of message that we've talked about today in terms of how we infuse more money into the pockets of low-income California families. Ms. Jackson.
30 seconds to still get over that last.
I know. I'll bring you the bill and show you the language. Ms. Butler.
Thank you, Senator Mitchell, and thanks to the committee really for inviting me to be a part of today's discussion. I join you, Senator Jackson, in learning from the last panel, and only hate that I missed the first panel. But we're talking about poverty and how we develop strategies to, as the advertisement says, sort of create opportunities. And like most women here and most women in our communities, I join you today in wearing many hats. Today, I sit before you as president of SEIU United Long-Term Care Workers, representing over 180,000 in-home caregivers and nursing home workers across California. As president of SEIU California, representing more than 700,000 working men and women who are social workers, nurses, security officers, janitors. As vice president of SEIU International Union, representing 2.5 million working women across the country. Specific to this conversation, I think, are the last 2 positions that I hold. As co-convener of the Raise the Wage Coalition in Los Angeles, California, that's based, whose focus is really to raise the minimum wage in Los Angeles to $15 an hour, enforce that wage, and provide earned sick pay, with the hopes of creating Los Angeles as a springboard for a comprehensive policy across the state and across the country. And in my last role, I think, is also critical to this conversation. I sit before you as the mother of an 8-month-old. And thinking about what are her opportunities, what is going to be her pathway, and what's my commitment and my responsibility today to make sure that she has a tomorrow that she can be proud of. So as the committee and the panelists that preceded me this morning, I each day wake up humbled by the responsibility of representing many of California's working poor. I'm humbled by their long hours. They're taking buses each way to do the job in which they are using to provide for their families. I'm moved and motivated by their monthly struggle to balance paying for basic necessities, food, rent, clothing for their families, while they clean our schools, while they provide care in our hospitals, clean our office buildings. I'm awestruck by their commitment to caring for and protecting our children, while theirs often face an uncertain future. Poverty in all forms is dehumanizing. And I am continuously impressed by the will and the spirit of men and women who wake up each day refusing to be defeated by it. There is not one single solution, and each of us share the responsibility. Those of us in this room did not create the problem, but the question before us is, how do we solve it? From my vantage point, one principal way is through improving work wages and working conditions. Momentum is growing across the nation to raise the minimum wage. There are proposals working their way through Congress as well as many state houses across the country, including right here in California. The cities of Seattle, San Francisco, Oakland, San Diego, and San Jose have all taken action because business, community groups, nonprofit organizations, and labor leaders all recognize that we cannot truly alleviate poverty, much less eliminate it, without increasing wages. As an organization, you've seen SEIU is committed to raising wages not only for our members through our process called collective bargaining, but putting our resources to the use of everyone in our communities to raise wages for all working men and women. And that's why we've been leaders in the fight for 15 and a union. For which over the last 2 weeks, I think on April 15th, you saw the largest rallies and collective direct action in the nation. This was indeed a worldwide effort. These rallies and activities took place in 220 cities across the world in 40 countries. We think that we are seeking innovative ways to attack these kinds of policies of poverty, whether they are legislative policies, legal initiatives, or they are a crisis of our morality. We do this not simply because of self-interest, and frankly, not just because it's philosophically right. We do this because raising wages and lifting families out of poverty is both a moral imperative as well as an economic one. Research from respected economists and research institutions like the California Budget Project, the Economic Roundtable, the Economic Policy Institute, and the Center for American Progress, as well as others, have all issued reports and analysis this year which reveal that a comprehensive approach to raising the minimum wage can be a driver towards real and sustained economic growth. Executive summaries of these reports, many of which focus on the Los Angeles campaign, are in your binders. But for the purpose of the remainder of my remarks, I'd like to focus on Los Angeles. As we know, it's an incredible population center in our state and a driver of a large part of our state's economic activity. Los Angeles is the second least affordable city to live in the nation, trailing only San Francisco. And it is the poorest major metropolitan area in the country with one of the highest costs of living. 723,000 employed working-age adults earn less than $15.25 an hour. 22% of those earning below $15.25 live in poverty. Income inequality is, of course, one of the biggest issues the city of Los Angeles faces, and women, children, and communities of color are amongst the most affected. In their study of the broader Los Angeles region, the Economic Policy Institute went beyond traditional measures like the poverty line to account for differences in regional cost of living, as well as they included things as well as basic needs like childcare, transportation, and food. They found that more than half of Los Angeles families do not earn enough income to attain even the modest standard of living. They estimate that family budgets for Angelenos in the metro area range from a low of $34,000 a year for a single person with no children to $91,949 a year for families with 2 parents and 3 children. That's what would be required to provide the basic needs. Roughly 2 million families or 4.5 million people fall below this budget threshold. We know that the statistics vary considerably by gender and race. Approximately 34% of whites have incomes below what's required to survive in the broader LA metro region, determined by EPI's family budget calculator, while 77% of Latinos fall below the threshold. Nearly 80% of non-citizens living in Los Angeles are below the family budget line. For African Americans in the city of Los Angeles, 42% of LA's African American families earn less than $15 an hour, and 29% of African Americans live in poverty. That's more than triple the actual population size of African Americans in broader Los Angeles region. In LA City, the Economic Roundtable found that 16% of Asian Pacific Islanders live in poverty, and 36% of API workers make less than $15 an hour. What's striking about many of these statistics is that those of us here know that women and families are the principal victims. 58% of single parents who are principally women are working in poverty in Los Angeles. Women make up the bulk of the workforce in low-wage industries like home health and healthcare, food services, caregiving, and I think the term was mothering professions named by earlier panelists. Working in these industries fuel the same gender pay gap in Los Angeles that persists around the country. In tipped worker industries like restaurants, food service, beauty services, nationally, women comprise 70% of tipped workers. In Los Angeles, that number is 63%. Women in these industries earn less than their male counterparts, and 70% of all female tipped workers earn less than $25,000 a year. This holds back family incomes, even keeping some women out of the workforce because they can't find jobs that pay enough to support their families. And many workers, many women who work 2 or 3 jobs and still can't afford to get by. And the amount of the wages aren't the only issue. Wage theft is rampant in Los Angeles and in California as a whole. Simply put, wage theft is defined as the illegal withholding of wages or the denial of benefits that are rightfully owed to an employee. It occurs when employers fail to pay employees for their overtime, when employees are misclassified, when there are illegal deductions in pay, or when they are simply not being paid at all or not being paid the true minimum wage. A disproportionate number of victims of wage theft are women and people of color, with 8 out of 10 low-wage workers in Los Angeles experiencing some form of wage theft. Every week, workers lose $26.2 million in wage theft violations, the highest of any other major city in the country. I mentioned earlier that the goal of the Raise the Wage campaign is seeking to raise the minimum wage as both a moral and an economic imperative. I don't make this statement lightly, but I do so without fear of contradiction regarding the positive impact it will have. In their March 2015 report, independent researchers at the Economic Roundtable found that increasing the minimum wage and enforcing it will lift hundreds of thousands of workers out of poverty, creates tens of thousands of jobs in the region, and that businesses overall stand to benefit from the economic stimulus that will result when women and families have more income to spend in their communities. because workers today earn less in purchasing power than they did 35 years ago. Low-wage earners have actually lost a third of their buying power over the last 30 years. Raising the minimum wage in Los Angeles to $15.25 an hour will increase earnings by $5.9 billion for 723,000 workers by the year 2019. But the workers aren't the only ones who will benefit. Businesses will reap the rewards of increased spending by households at neighborhood, service-oriented businesses such as healthcare, restaurants, and retail. The region will create 46,400 new jobs, of which 24,875 will be in the city of Los Angeles. In Los Angeles, every dollar increase in the minimum wage will result in $1.12 stimulus to our overall economy. Every dollar creates $1.12 stimulus. And perhaps I think the most relevant to this body, state and local governments will receive $414 million in added revenue, and the federal government approximately $546 million. Public assistance expenditures will be reduced by $313 million a year because higher wages lift working men and women out of poverty and prevents them from receiving those public assistance benefits. Senator Mitchell, you've heard me say that there is a common saying that my grandmother says to me, when you know better, you do better. And in this instance, there are so many economists and respectable research institutes that have said to us that raising the minimum wage is a solution to the poverty that exists in our community. Part of the charge that I was asked to speak to with my comments is creating the campaign. And what we have learned in the campaign, both SEIU nationally and worldwide, as well as the coalition in Los Angeles, is that poverty alleviation cannot be a campaign. It has to be a mission. Because campaigns have a start date and an end time. Missions are what drive us to act consistently. We have to have mission-like strategies that include real policy solutions, as panelists before me have already discussed. We have to create the broad-based coalitions that don't allow those who might be in opposition to divide all of us who need poverty to no longer be a part of our lives and a part of our families. We have to have policymaker leadership. As was discussed when Senator Jackson raised, well, who made the policies that govern how maximum family grants are administered in our state? It requires leadership to change those policies. And I think that we cannot be afraid of what makes our nation so great and our state so special. And that is the freedom and will of collective direct action. Policymakers have to hear the voices of those impacted by the policy in order to create the most informed policies. I think the campaign in Los Angeles is a model, hopefully, that can be replicated all across cities in the state, and hopefully will be celebrating the passage of Senator Leno's bill to raise the minimum wage in the state, and hopefully we'll be celebrating the passage of Senator De Leon's wage theft legislation, and hopefully we'll be celebrating the passage of true earned sick pay for all of California's workers as we are creating these policy initiatives to really move forward our collective mission to eliminate poverty in the state of California. I'm appreciative of the time that the committee has allowed, and I'm happy to take any questions.
Thank you very much for taking the time to come here today, and you clearly have provided the data that we've been seeking with regard to the intersection between race, poverty, and gender, and the statistics you shared today, so thank you very much. You may not have been here when the first panel spoke, and we were told about the example of Great Britain. And in 1999, Great Britain made the decision that they were going to reduce child poverty. And they referenced 3 or 4 policy positions, but didn't go in depth. And I'm not sure if increasing the minimum wage was a part of that. Are you familiar with their 10-year effort?
I'm not familiar with the Great Britain example, but I will say a McDonald's worker in Sweden earns $21 an hour. The minimum wage in Australia is $19 an hour. These are countries where we don't see the level of poverty and deep poverty that we experience in one of the richest nations on earth, and one of the richest states within that nation.
Mm-hmm. Mm-hmm. Well, that's certainly, the Great Britain model was new to me today. Everybody's had their takeaways. The Great Britain model was frankly my takeaway, because they were able to reduce the number of children living in poverty over 10 years by just under 2 million, 1.8 million. And I think the juxtaposition, that was 99, to the US, we were 96, we were putting forward federal welfare reform that some would argue help launch more families and children in poverty.
The other point that I would make, Senator Mitchell, about what I do know of Great Britain is the strength and size of their labor movement. I would suppose, and what I think the facts will bear out, is that over the last 30 years, as the decline of the U.S. labor movement has led to a growth in poverty and a growth in our working poor population, that the growth and stability of the labor movement in Great Britain has actually helped be a tool to lead to some of the results that I'm sure other panelists had spoken to. It is known in our country that being a part of a union and essentially guarantees at minimum 40% more than your non-union counterparts, no matter what occupation you may work in. And I would venture to say that also may be a tool as to the Great Britain model.
And so it's not enough for us to look narrowly at kind of the general public assistance programs that in our state are not lifting families out of poverty, which is what the CalWorks statute says it's designed to do, to lift children out of poverty. But clearly we're supporting people who are living at subhuman levels.
Sure.
And so, and looking at a policy like Great Britain, where it was designed to reduce poverty, it's got to be a broader perspective. And so your points about the growth of the labor movement and union jobs in those instances would validate that.
I think, as I said in my comments, and as I think you've experienced through the panels today, there's more than one area of problem.
Right.
And I think what we're learning is that there has to be more than one area of solution. Right. We have in this nation experienced the labor movement as a true tool and vehicle to lift families out of poverty. The biggest growth of our nation's middle class existed at the same time as the largest growth of our nation's labor movement. That's not a mistake. Right. And I think as we have seen our biggest problem now become income inequality, we've also seen a problem with the decline of our labor movement. And we have, I think there were political leaders who were willing to make the investment in creating New Deal plans and other structures that help to lift our families out of poverty. And I think we have to have all elements really working on the same mission. Either we want to eliminate poverty or we don't. Mm-hmm. And I think Senator Mitchell or Senator Liu made a comment earlier about maximum family grants, that it's about political will at this point. Mm-hmm. And I think it is about our collective will as to what kind of society are we going to create.
And so to paraphrase and quote your grandmother, which I intend to do, with your permission or not, we now know better and therefore are required to lead better. I am crystal clear about my challenge as chair of the Select Committee, and sure many of my colleagues will share that as well. Thank you very much
Thank
for
you
your
so much.
testimony today. Appreciate it.